Thank you everyone who joined this webinar session. Before I get started, I wish to begin with an introduction on SleepASAP and the guest speakers who have joined us today. So a little bit about SleepASAP. SleepASAP is a new global sleep management education platform established by an international team of specialists from different fields such as art therapy, music therapy, psychology, and neurology. And we've gathered here in order to both promote awareness and to provide effective and affordable alternative solutions beyond the normal pharmaceuticals to people who have sleeping issues. Whether you have sleeping issues, work in this field, if you are just in general want to learn, it is intended for all of you. So let's start with Dr. Yashu Wheeler. Dr. Yashu Wheeler is an integrative medical doctor. Her passion is bringing together the best from different medical paths and traditions to empower people to live healthier and happier lives. She created the Sleep Kit to help people sleep, and you can all look it up, and I'm sure you'll enjoy it. And also, we have here another really fascinating guest speaker, Edward Grandi. Edward Grandi served as an executive director of the American Sleep Apnea Association from 2004 until 2014. While not a physician or an apnea patient himself, he became a subject matter expert on the condition, serving as a resource to the public and the medical community with articles and presentations on the topic. He continues to be a resource on sleep health and sleep disorders on social media, with curated and original posts on Facebook, LinkedIn, and Twitter. So first, welcome both of you, and thank you for being here. And before we get started with the questions, I just want to point out one more thing. As you'll see here on the left, on the bottom screen, you can see someone drawing down what's going to happen. This is Anna from Ukraine. She'll be drawing this entire session out. She does a beautiful job, and she's very loyal. So let's get started. I want to start with the first question from a member. And he writes this: I'm afraid I have a sleeping problem. How would I know this is a temporary issue or a chronic one? So let's start with Dr. Yashu. Would you want to give your input here?
So first of all, I need to know a little bit more about the problem. How long has this problem been going on? And have they had sleeping problems before? You know, have they at any time slept well? So I'd need to know a lot more than that's difficult to answer that question just based on that one question. So, I mean, I can understand what somebody says, what somebody's asking. I've got a sleeping problem. How do I know that it's ever going to get better? And what I would say is if anyone has a sleeping problem, get help. Because if you get help, if you have a problem and you can't deal with it yourself, it's time to get help. And when you get help, then you can actually find a way of dealing with it and resolving it. And so I would say to whoever that is, please get help.
Okay, and Edward, do you want to also answer this as a sleep educator yourself?
Well, my suggestion, I completely agree with Dr. Wheeler. My suggestion would be, assuming that this is something that's just starting, a useful tool would be to keep a sleep diary for a period of time. And this sleep diary would record what time you go to bed at night, what time you wake up in the morning, whether you have awakenings during the course of the night. And using this sleep diary, or you could maybe use an app. They have many apps now that are available for the smartphone to record this information. With this recorded information, you could take that to a specialist who would be able to help you discern whether the sleeping problems may have to do more with sleep hygiene as opposed to having a problem like insomnia or sleep apnea or restless leg. But absolutely, if somebody recognizes that they have that they're having a problem because they wake up not feeling refreshed, then they do need to consult a healthcare practitioner familiar with sleep issues.
Okay, that's nice. It's actually very connecting to what I know is Yashu Wheeler's philosophy, that there's a trigger of a red light that we should all be aware of. And like you're saying, as soon as there's a red light, Edward, you're saying, write a diary, start writing it down and record it, and follow on it. And don't let this red light just stay there and live with it, but monitor it and try to actually give it the right attention that it deserves.
Yeah, yeah, yeah. Can I say something more about that red light? And I think that when somebody has a sleeping problem, and by the sound of the question, it sounds as though this person hasn't had a sleeping problem before. Otherwise, they wouldn't be asking it in that way. But it is like a red light that comes on in the car, and the red light comes on in the car to tell you to stop, to look at the problem. And I think so many people, when they get a sleeping problem, what they want to do is they want to get it fixed as soon as possible. They want to take a pill that will sort it out so they don't have to deal with it, because it's so frustrating when you have, night after night, even for 2 or 3 nights. By the time after 2 or 3 nights, the last thing you want to do is to actually try and go and sort it out. You just want it fixed. And what I'm saying and what we're saying is, see it as something that needs your attention. And I think a sleep diary is a fantastic idea. And sometimes it can be as simple as that you're going through a stressful period of time in your life. And so, you might want to listen to my story time, which is free on iTunes. But, it really is about finding out what the cause is, why you're having a sleep problem.
Okay, great.
Yeah.
This is sorry, Edward, you want to say something?
Just I want to emphasize that that using sleeping pills is not a solution, a long-term solution. It may be a short-term solution for a problem that may be due to stress or jet lag, something like that. But you really want to try and get to the root of the problem that's keeping you from being able to get a good night's sleep.
Right. So this is something we're going to touch up in a bit with another one of our questions. So I'll go ahead into my second question here that we've got from one of our members. She writes, I want to stop taking pills to help me sleep. I was advised by a friend to try alternative medicine. Where do I start? Who do I approach with my sleep issues for further direction? So you started this now, Edward. You want to answer?
I can certainly, using sleeping pills can creates a whole nother set of problems, particularly ones where that interfere with the dream portion of sleep, where in fact sometimes people taking sleeping pills actually act out their dreams and develop a different sleeping disorder. But certainly an alternative to using sleeping pills for addressing insomnia is cognitive behavioral therapy. That's one alternative, which is about training yourself to be able to fall asleep and stay asleep. I don't know, Dr. Wheeler, do you have any insights on alternative therapies?
Yeah, look, absolutely, Edward. And I mean, in answer to that question, I think that lots of people, like, what do you do? Where do you go for help? Is your first point of call your doctor or what? And is your doctor just going to give you yet another pill? And I think that as, like, I had my own medical practice for 14 years in New Zealand, and in the early days, that was how I would treat insomnia. And I'm appalled now at how I was taught to treat insomnia as a GP, and I know that a lot of GPs or family practitioners or whatever you call them do give pills, and that is not the answer, as you say, Edward. So that's why I'm not the object of this exercise is not to promote my sleep kit, but that is why I have created a kit where I bring CBT. I say CBT, cognitive behavioral therapy, is how you think and how you behave around sleep and what you need to do to change that or what you need to change about how you think and how you sleep and how you behave around sleeping in order to sleep well. But I find CBT, and many other people have told me, that they find it quite dry and boring, and that's why I've integrated it, and I've brought lots of other different approaches and integrated in the kit. So I use story time, I use guided relaxations, I use something called neurolinguistic programming, I use exercises, sleep confidence exercises. So it is an integrated approach, and I'm also quite a fan of, even though it's not about pills and it's not about using something external, sometimes simple things like in England and New Zealand we have something called rescue remedy, which is a Bach flower remedy, and sometimes something as simple as that can take the edge off. But you know, when you're feeling slightly anxious, or a homeopathic remedy or something from your health shop. So sometimes things like that can help short term, but as long as you're doing the other things as well and not relying on those and just replacing those, because they're not going to work.
So I'll try to connect this though, as someone who goes to classical medicine as well. I know that the formal procedure is usually you go to a family doctor, and then he starts directing you to one other stage, and then from there on you go to the next stage. So when we're talking about alternative medicine and alternative care, is there a base where you start?
Again, it depends a lot on where you are, you know, where you're getting healthcare services from, and in terms of being able to identify alternative and complementary medicine, you know, in some parts of the world, it's generally more accepted. Here in the United States, it's less accepted. So it's difficult to get a referral from a family practice or general practitioner to someone who can provide alternative or complementary medicine. You know, sometimes you have to go into the, you know, to look in, I mean, certainly looking on the internet. The challenge, of course, is finding somebody that's going to be qualified. There, I think ultimately it might be a question of going online and finding a community where you can ask questions about practitioners who would be familiar enough with the different alternatives, particularly with regard to sleep, that would be able to help you. So it's not, I wouldn't say it's easy. It's not a question of going to the phone book and finding somebody. It might be a little bit more. It might be a little bit more of a challenge.
Right.
Can I just speak to that? Can I just speak to that? So I think this is the whole thing, and this is why I'm so excited about integrative medicine, because you know, orthodox medicine's really got something, and science really got something to offer, and let's get let's get a diagnosis first. And I think that's the thing. If someone comes to me and they say they've got a sleep problem, I want to ask them a few questions to find out what that sleep problem is about. And then once I know what that sleep problem is about, then I can direct them. So it's no point going to an alternative therapist if they're going to do, you know, they might be like a craniosacral therapist, or they still need to make a diagnosis. And I think you need to go to somebody who understands about sleep and who's got the whole picture, and then they can make the diagnosis. So let me give you some examples. So say somebody comes to me, and the reason is that they've just gone through a very stressful period in their life, and you know, they've had a stressful period, and they've started drinking alcohol at night, and the stress is gone, but they're still drinking the alcohol at night, and it's the alcohol, which we all think alcohol is a relaxant, but after a couple of hours it's a stimulant, and then I discover, well, actually let's cut the alcohol and give them some relaxation exercises to do instead, or they can go to a yoga class or something like that. And then they find out it's the alcohol that's causing the problem. So what I'm saying is there's a myriad of of problems that can cause sleep problems. So it's not about, it's about going to somebody and getting a diagnosis, and the first thing is the diagnosis, and then you can decide who you're going to go to. So if somebody comes to me and they're just really, really stressed out, I might say that the best thing for them is to go to a counsellor to deal with the stress, um, or go for a massage or something, or exercise. So it's different for everyone, and I think that's the whole thing about looking at sleep from an integrated approach. It's
Yes.
not an alternative approach. It's not an orthodox approach. Let's work together. Let's bring the best of all worlds to the table.
Okay,
Yep.
so you actually started touching a very symptom that we know that causes sleep deprivation, and that is stress. And you also just answered one of the members that I was gonna ask their question, who wrote this: "Who can tell me if stress is the cause or the result of my sleep problem?" So I think it's pretty much what you just said.
Yeah, the answer to that question is yes.
Yeah.
Yes.
Because
Okay.
stress causes difficulty getting to sleep, but and also difficulty getting to sleep causes stress during the day. So it's actually bidirectional, and you need to. I mean, clearly, stress is something that occurs when you're awake. So in order, you need to deal with it while you're awake in order to be able to keep it from affecting your sleep. So, as Dr. Wheeler suggests, there are techniques that can be incorporated, not the least of which is perhaps changing things in your life that could be causing stress, or at least identifying them, the stressors in your life, and trying to manage those as best you can. And then from there, looking at how it would impact, how you can keep it from impacting your sleep.
Great. I want to now go to another question that we've got, and it connects to the stress, and now it goes more directed into the mind process. And I want you to both give it a go. The question is this: since I started having trouble falling asleep, I feel more nervous. Why is that? So maybe you can guys give this input of what's happening now that I'm already stressed. I started having troubles with my sleep, and now before I get into that position of falling asleep, I get nervous. I start racing thoughts. What's your opinion here?
Mhm. It's the as Dr. Wheeler said at the outset, it's always difficult to be able to, with one little kind of nugget, to be able to assess what may be causing these problems. And so, I mean, it's you know it, difficulty. It, people don't know how to relax. They maybe they're on their smartphone, the bed, maybe they're on the computer, maybe they have the TV in the bedroom. These are all outside influences that could be potentially keeping them from being able to relax before they go to sleep. I mean, certainly, um, it's I think stress and anxiety, um, especially with regard to sleep, means practicing good sleep hygiene. And I think an element of good sleep hygiene is learning how to kind of wind down before you go to sleep, sort of getting sleep to go, as opposed to just kind of, turning the light out and expecting that in 2 minutes or something like that. But,
Dr. Yashu Wheeler, do you want to give it a go as well? You want to
Sure. Well,
give your input here?
yeah, of course. I love that answer, Edward. I mean, it's so true. But one of the things that this question brings up is that so many people who I've worked with, when they first come and see me, they say, "Oh my goodness, this is the worst thing. It's just awful. Please take it away. Get sorted out as quickly as possible." And then once they've gone through the journey of the kid or working with me, what they've said is actually the insomnia or the sleep problems were a gift. And once they see the insomnia as a gift, because, you know, if it wasn't for the insomnia, they wouldn't have to face the fact that they were stressed, or they wouldn't have to face the fact that they were being bullied at work and it was only at night time that they were worried about it, or they wouldn't have to face the fact that they were anxious or whatever. And it was only the insomnia that made them deal with it. And, you know, relaxation is a skill that improves with practice. And stress is something that improves with practice as well. It gets worse with practice, yeah? So, you know, whatever you practice, you get better at. And so if you're having problems sleeping and getting anxious at night, by keeping on doing it and doing it and doing it is just making it worse. And that's why I say stop the car, the red light, stop the car, and go back to the drawing board. Get someone to tutor you, get someone to help you, who knows what they're talking about. And then see it as an opportunity, like so many of the people that I work with. And it's a gift. Insomnia, would you believe, is so often a gift. Teaching, you know, ready to teach you something that's so profound.
Great. So I want to take now this alternative care that we're speaking about so much, and I want to give you a member now. I want to speak about a member who's now contemplating using pills. And this member asked us, can you tell me what are the advantages and the disadvantages of taking sleep medications? So I would like to know, you both have a lot of experience here as well. And you, Peter, and you also as a doctor, I would like your inputs on this as well now. You want to start, Edward?
You know, sleeping pills are they, you know, the challenge of sleeping pills isn't so much that they help you to sleep. The problem is that you can become dependent on them. And one of the things that can happen with certain types of sleeping pills is that it interferes with the dream portion of your sleep, and that in fact people can begin to act out. They can develop what's called parasomnias, where they're actually acting out their dreams, and really kind of getting out of the bed and even leaving their homes and driving a car. There's a story about a famous congressman here in Washington, D.C., who had this experience taking sleeping pills. I think that the challenge about using sleeping pills on a long-term basis is that it's not addressing the problem, as Dr. Wheeler has indicated. You know, it's really, they're intended for a very short period of time, as opposed to something that you would take in the same way that you would take a blood pressure medication for high blood pressure, or something, or you know, something for insulin, managing insulin resistance. So I think that you using a pill for sleeping doesn't get to the problem. So
Well, as far as Dr. Yashu, I think she will definitely agree with what you said. But I would love to hear her also speak about this as well.
Okay. Well, I mean, you know, I know, of course, from what you said, Edward, I've got to be disciplined to keep speaking about sleep. But I have to take this opportunity to say something, because I'm so passionate about integrative medicine. You talked about it's just like a high blood pressure, you know, medication, and that's the whole thing, you know. In my practice as a GP, I would give people a medication for high blood pressure because that would keep them safe. But then I would say, now, what are you going to do to deal with this, you know, because it was maybe the stress or something causing the high blood pressure. And then I would encourage them to deal with the stress so that they wouldn't have to be on the blood pressure medication for life. And also, you know, I also run a weight loss program, and which is an integrated weight loss program. And again, you know, somebody came to me who was going to go on their first medication for diabetes, and I said, I can't do this. I've got to lose weight. And they said, well, you know, they couldn't. And I said, yes, you can if you go about it the right way. And I think that's the whole thing in medicine is so often people are so used to, here's a pill for this, and then you don't have to deal with it. And where my passion is okay, let's use a pill, very short term if it's dangerous, but let me challenge you long term to take responsibility for yourself and do something about it. And you know what you said is so true. You know, kind of there was that I forget the medication that was all that problem in the States of that senator getting up and whatever it was called. But you know what I mean.
Yeah.
The thing is this. I think this is the whole crux of the matter, because you know what happens is a sleeping tablet works for somebody short term, and it works for about. It might work. Yeah, it doesn't work. I've tried them and they haven't worked at all. But it might work for somebody short term for a week. Yeah, and then they're just getting back into a good sleeping pattern, and then it doesn't work, and then they think, oh my goodness, and then they try it again, and they try it again, and it doesn't work, and then they look for another sleeping pill, and that might work for 3 nights, and then it doesn't work, and then they look for another sleeping pill, and they look for another, and they keep on this desperate task of looking for other sleeping pills because the first one worked for a week. And I think that's the whole thing. You know, once people really understand that sleeping pills might work for a night or 2 or 3 or 4, but they're not designed to work long term.
Right.
So, you know, once you get that, you know, it's this quick fix only lasts short term if it's going to work at all. And so take the opportunity to deal with the underlying cause and stop treating the symptom. The insomnia is the symptom of the underlying problem. And the underlying problem might be as simple as drinking alcohol at night, or might be as simple as going to bed too early and you're not dealing with your melatonin cycle. And that's where it's so exciting, where we have medicine and we have science explaining what's actually happening in the body. And once we understand it, then we use the you know, neurolinguistic programming or the alternative medicine, the homeopathic remedy, or whatever. We bring in anything that is going to work with the minimum side effects. You know,
I want to enter here because we have one of our questions was exactly on this issue, that medicines are temporary, and this member wrote this, and this is why I'm so glad that you just touched this. She writes this: I'm starting to lose my sense of reality. I'm a non-functioning insomniac. My doctors do not want to give me something too strong to really get out. Can you offer me any tips or advice based on your experience with hardcore insomniacs? This is exactly the point that we just touched, that the pills are also temporary. And this one just wants aid, and she wants it fast. And I want you to touch on this, that we look for things, for solutions that are quick, and even pills that the majority of people believe in. They're not temporary. They are temporary. I'm sorry. They're temporary. And with time, you'll have to use more heavy pills, more heavy drugs. So I want to maybe go into your opinion here as well. Give me your experience with hardcore insomniacs, as she writes. How can we help her?
I'll leave that one for Dr. Wheeler.
Yeah, well, I think, you know, the most important thing, you know, in my kit, I talk about a 4-step process, and the first step is acknowledging the problem and accepting that you've got a problem and it's time to find a solution that actually works long term. And until while somebody's looking for a quick fix, you know, they're not willing to actually deal with the underlying problem. And if she just wants a pill that will sort it out and make it go away, then she's always going to be looking for that forever. So, you know, what I would say is, you know, I think when somebody gets so tired, they don't want to have to deal with the problem because they want to get on with their life. But it's staring them in the face, and it's the issue that they need to deal with. And until they've dealt with it, it's like a baby that's crying. You know, you might want the baby to shut up, but until you actually go to the baby and hold the baby and give it attention, it's not going to be quiet. And then when you've given it the love and attention, or given it the food or whatever it needs, then it will be quiet. And it's the same thing with our body. And that's what's so exciting about our human body, is that the human body communicates with us through symptoms. And insomnia is a symptom.
Edward,
I guess
you want,
what I would
you want-
add, what I would add to what Dr. Wheeler is saying is for the member who wrote this question, is that it's going to be a longer term project than just finding a medicine. Really, there's a lot of pieces to this, not the least of which is trying to understand her sleep. So using a sleep diary is important. Looking at her sleep hygiene, what are her practices? What time does she go to bed? What time does she wake up? What kind of a bedroom does she have? What kind of an sleeping environment does she have? What does she eat before she sleeps? How often does she use caffeine? And if she's drinking this, a double espresso 5 minutes before she goes to bed, it's highly unlikely she's going to be able to get to sleep at all. For some people, they metabolize caffeine very quickly. Other people, it takes a very long time. So that caffeine will keep people awake. But I think that in this particular situation, I can sense, the question. She's very frustrated, and she wants to be able to sleep at night. I think what she needs to do is she can't. I don't think it's going to be a general practice physician who's going to be able to solve her problem. She's going to need to work with someone like Dr. Wheeler, who's going to be able to take her on this journey. Again, recognizing that there is a problem, and then through the various steps to where the problem will be resolved. It's it's not an easy answer. It's a difficult answer, but it seems to me that that's what has to. You can't you can't expect to be at the top of the mountain from the bottom of the mountain without making that trip, and it's unfortunately that's what it is.
Right. So I want to leave some of the other member questions for the next time, and I want to just add some questions myself here. I recently read a very, very interesting blog by Dr. Nahum Kowalski, who's also the normal moderator here, and he said something I believe we can all agree with. Doctors and the public tend to see classical medicine and alternative medicine as a dichotomy. You're either in one group or the other one. I want to ask you, I'll start with Dr. Yashu, how can we overcome this barrier? How can we integrate what is referred to today as alternative medicine into the toolkit? We like the toolkit as well. How can we put this into the toolkit and not leave it as a last resort, as it normally is for medical doctors?
Yeah, it's a change of the whole mindset. I mean, it's huge. And
how do we open up though? Speaking.
I think like so. See, I'm not really into that word alternative medicine. I'm much more into integrative medicine because I want the best of all worlds, and I think more and more. I mean, I know in New Zealand, less so in England actually, but because of the NHS, but people are seeking out these types of treatments. People are going to the acupuncturist, they're going to the homeopath, and they're going to the health shop as their first port of call. And as a GP, people would say, "Well, I've gone to the health shop and I've done this and I've done that and I've done that, and it's not worked, so I've come to you, to see you, as in your medical capacity." So, although most people who came to me knew that they would have an integrated approach, so they'd come to me as a first point. But and I think the change is happening from the public, from the general public. It's not actually happening from the medical world. And I think there's a few of us. I've just been a tutor on a wonderful whole health day at a university a couple of days ago, teaching medical students that there's more to health than pills and surgery, and so it's starting to happen, but it's very, very slow, and I think, you know, like, you know, what you're doing now, what we're doing today, is part of this change. We're saying, let's use science to make a diagnosis, and then let's discover from this great buffet of choice what the person's going to choose to help them the most on their journey. So, I mean, unfortunately, you know, I meet so many orthodox doctors, and many of them are just so against a lot of what I talk about and think that I'm a weirdo. But then, interestingly enough, when something happens to them, they secretly come to me and say, well, what would you do in this situation? Because I actually don't want to have that. You know, what would you do? And then I go for a walk with them on the beach and make some suggestions. And then they start thinking in a different way, but usually only from their own experience.
Edward, do you agree? What's your perspective here? I would love to hear that as well.
Thank you. I agree with a lot with Dr. Wheeler. You know, the position my position as the executive director of the American Sleep Apnea Association put me in a very interesting spot to be able to see a lot of what was going on. You know, frustration on the patient side, and then also to some extent frustration on the physician side as well. Here in the United States. And I think one of the challenges in terms of being able to incorporate other therapies into the treatment of disease is that physicians, they're trained as scientists, and as scientists, their assumption is that they are going to want to see evidence of effectiveness. And I think that, you know, the notion of a randomized controlled clinical trial, double-blind, with a large set of patients participating in it, is very difficult. And I think that is, as a standard for determining the efficacy of a particular type of treatment, is not entirely fair. It's just, what it's doing is you're setting the bar so high that it's going to make it very difficult to be able to make make an assessment about how effective it is. So in a way, what happens is that alternative treatments and integrative practices kind of get lost because they don't meet the requirements of scientific evidence. So it's kind of putting them at a slight disadvantage. But what ends up happening, in fact, as Dr. Wheeler suggests, is even the doctors themselves, when they reach a particular point when they hit the brick wall and they need help, they're going to look for anything that's going to be able to help them. And so, you know, the question is to get them to come out of the closet, as it were, and to admit that an alternative therapy was effective in terms of addressing their particular medical issue. Now, the other thing too is that times are changing, and with any luck, the new physicians coming on board have a much more open mind because they're participating in courses or in reunions with physicians like Dr. Wheeler, who are, you know, that the world of treatment is much broader than just a pill or surgery or anything like that. I don't know, does that help?
Yes, of course. We're very, very short on time, and I had here two questions I wanted to put in, and I decided on one because connecting to this last point that we touched. In the same article that Dr. Kowalski, who was also, by the way, a physician, in that same blog that he wrote, he said this. He said, doctors, healthcare workers, and patients all have to realize that we're still far away from having all the answers, even for problems that chronically plague people and make their lives almost unlivable. We all have to keep our egos in check and make sure we're working to find the best individual or combination of treatments that help patients. I want to ask you both here as the last question. How do you see classical medicine and alternative care working together to best help a patient with sleep difficulties? So we'll start with Edward because you already got into it. We'll finish off with Dr. Yashu.
I just think that it requires the patient to be engaged and to be a little bit aggressive in terms of wanting to get answers to their questions. They can't really be passive and just expect the medical system to address their concerns. They need to be educated. They need to participate in programs like SleepASAP to be able to learn more, to be able to ask the right questions, and to be able to to ask for the treatments that they need.
And Dr. Yashu?
Well, I think it's all about valuing yourself and valuing yourself. And so did you hear that? I think it's all about valuing yourself and valuing your health. And so often people want to go to the doctor, and in England it's free, just to get a pill and not have to deal with it. Whereas, if you actually have to take the time and you take the responsibility to get to the problem yourself, and the doctor's just there as your guide, as one of the people that you go to for help, and
Wow.
don't give away your personal responsibility. Take responsibility for your own health, and that's what I would end.
Well, I really, really hope we will come to that future where cooperation will win in the end. And unfortunately, we won't be able to keep going with questions for this session, and we'll have to leave it for our next sessions. So that was all for today. I want to thank you both once again, and also thank all our viewers and members. Please join us also on Facebook, Google+, Twitter, and of course, Meetup. We wish you all the very, very best and hope to see you soon next week. Same time, same place. See you there.
I've got a sleeping problem. How do I know that it's ever going to get better? And what I would say is, if anyone has a sleeping problem, get help. Because if you get help, if you have a problem and you can't deal with it yourself, it's time to get help. And when you get help, then you can actually find a way of dealing with it and resolving it. And so I would say to whoever that is, please get help.
Okay, and Edward, do you want to also answer this as a sleep educator yourself?
Well, my suggestion, I completely agree with Dr. Wheeler. My suggestion would be, assuming that this is something that's just starting, a useful tool would be to keep a sleep diary for a period of time. And this sleep diary would record what time you go to bed at night, what time you wake up in the morning, whether you have awakenings during the course of the night. And using this sleep diary, or you could maybe use an app. They have many apps now that are available for the smartphone to record this information. With this recorded information, you could take that to a specialist who would be able to help you discern whether the sleeping problems may have to do more with sleep hygiene as opposed to having a problem like insomnia.
Thank you everyone who joined this webinar session. Before I get started, I wish to begin with an introduction on SleepASAP and the guest speakers who have joined us today. So a little bit about SleepASAP. SleepASAP is a new global sleep management education platform established by an international team of specialists from different fields such as art therapy, music therapy, psychology, and neurology. And we've gathered here in order to both promote awareness and to provide effective and affordable alternative solutions beyond the normal pharmaceuticals to people who have sleeping issues. Whether you have sleeping issues, work in this field, if you are just in general want to learn, it is intended for all of you. So let's start with Dr. Yashu Wheeler. Dr. Yashu Wheeler is an integrative medical doctor. Her passion is bringing together the best from different medical paths and traditions to empower people to live healthier and happier lives. She created the Sleep Kit to help people sleep, and you can all look it up, and I'm sure you'll enjoy it. And also we have here another really fascinating guest speaker, Edward Grandi.
Or sleep apnea or restless leg. But absolutely, if somebody recognizes that they have that they're having a problem because they wake up not feeling refreshed, then they do need to consult a healthcare practitioner familiar with sleep issues.
Okay, that's nice. It's actually very connecting to what I know is Yashu Wheeler's philosophy, that there's a trigger of a red light that we should all be aware of. And like you're saying, as soon as there's a red light, Edward, you're saying, write a diary, start writing it down and record it and follow on it. And don't let this red light just stay there and live with it, but monitor it and try to actually give it the right attention that it deserves.
Yeah. Can I say something more about that red light? And I think that when somebody has a sleeping problem, and by the sound of the question, it sounds as though this person hasn't had a sleeping problem before. Otherwise, they wouldn't be asking it in that way. But it is like a red light that comes on in the car, and the red light comes on in the car to tell you to stop, to look at the problem. And I think so many people, when they get a sleeping problem, what they want to do is they want to get it fixed as soon as possible. They want to take a pill that will sort it out so they don't have to deal with it, because it's so frustrating when you have, night after night, even for 2 or 3 nights. By the time after 2 or 3 nights, the last thing you want to do is to actually try and go and sort it out. You just want it fixed. And what I'm saying and what we're saying is, see it as something that needs your attention. And I think a sleep diary is a fantastic idea. And sometimes it can be as simple as that you're going through a stressful period of time in your life. Yep. And so, you might want to listen to my story time, which is free on iTunes. But, it really is about finding out what the cause is, why you're having a sleep problem.
Okay, great.
Yeah.
This is sorry, Edward, you want to say something?
Just I want to emphasize that that using sleeping pills is not a solution, a long-term solution. It may be a short-term solution for a problem that may be due to stress or jet lag, something like that. But you really want to try and get to the root of the problem that's keeping you from being able to get a good night's sleep.
Right. So this is something we're going to touch up in a bit with another one of our questions. So I'll go ahead into my second question here that we've got from one of our members. She writes, I want to stop taking pills to help me sleep. I was advised by a friend to try alternative medicine. Where do I start? Who do I approach? Edward Grandi served as an executive director of the American Sleep Apnea Association from 2004 until 2014. While not a physician or an apnea patient himself, he became a subject matter expert on the condition, serving as a resource to the public and the medical community with articles and presentations on the topic. He continues to be a resource on sleep health and sleep disorders on social media, with curated and original posts on Facebook, LinkedIn, and Twitter. So first, Welcome both of you, and thank you for being here. And before we get started with the questions, I just want to point out one more thing. As you'll see here on the left, on the bottom screen, you can see someone drawing down what's going to happen. This is Anna from Ukraine. She'll be drawing this entire session out. She does beautiful job, and she's very, very loyal. So let's get started. I want to start with the first question from a member, and he writes this. I'm afraid I have a sleeping problem. How would I know this is a temporary issue or a chronic one? So let's start with Dr. Yashu. Would you want to give your input here?
So first of all, I need to know a little bit more about the problem. How long has this problem been going on? And have they had sleeping problems before? You know, have they at any time slept well? So I'd need to know a lot more than that's difficult to answer that question just based on that one question. So, I mean, I can understand what somebody says, what somebody's asking.